Well, good afternoon. I'm very pleased to be here this afternoon at the Woodbine Mall, one of the places where we have worked very significantly to increase vaccine capacity. And I'm pleased to be here with Dr. Eileen Davila, our Medical Officer of Health, who you will hear from in a moment or two, as well as with my colleague, Councillor Joe Cressy, the Chair of the Board of Health, and Chief Matt Pegg, who has been so instrumental to our successful carrying out of all the different things we've done throughout a very long period of time now. And I should point out he got his a booster shot today. So so if he's back there looking a little tepid, he has an excuse. I'm pleased to tell you that this is a really good example. This clinic that we're in, and you can see the size of it behind me, has gone from being able to provide 5,280 doses a week to now being able to deliver 11,000 doses a week. And we're looking to push that capacity even higher. In fact, we were told when we were on a brief tour this afternoon that 2,500 doses, booster shots in the main, but total doses, 2,500 were done here yesterday, and they expect to do the same again today. And so we came here today to thank the staff because, you know, in the end, as I said to them, and speaking a moment or two ago, we can have all the meetings downtown of the people who are in positions of leadership to help us get through this pandemic and get people vaccinated, but it's the people on the ground, the Team Toronto, as we call it, of which we have a large number here, who are actually getting this job done. And Team Toronto is continuing to increase our capacity to vaccinate, and in particular with respect to booster shots across the city. And it's happening in a whole bunch of different places, including here at the Woodbine Mall and the other 4 city-run vaccination clinics and mobile clinics. It's happening at more than 500 pharmacies across the city. It is happening through primary care providers, principally doctors, and it is happening in hospital clinics and through the clinics run by Ontario Health Teams. And I shouldn't in any way underestimate the fact that we have a lot of other clinics that are happening beyond the ones that the city itself runs, because this has been a partnership all the way through with the hospitals and with other healthcare providers. And it's significant to note that all of those partners taken together were able to deliver 45,609 doses yesterday, a huge increase in daily capacity over what we saw before we began to ramp capacity up. And it is why overall, we've been able to ramp up Team Toronto's capacity, vaccination capacity, from 400,000 to 1.2 million doses per month. And that is a part of our Toronto Omicron action plan, but it's something that I think is very significant, obviously, to people that we've been able in a short time to ramp that capacity up from 400,000 to 1.2 million doses, and our efforts are continuing. The Omicron action plan includes, first and foremost, increased vaccination capacity. And we're focused on getting third doses, booster doses, delivered to people as soon as possible. And that's why every part of Team Toronto, every one of those channels I mentioned, the city clinics, the primary care, doctors' offices, and so on, the health mobile clinics run by others, the hospitals, and the pharmacies are all looking for ways to increase their capacity, the throughput that they can have in their respective channels. I am very pleased to report that our efforts in an aggregate sense have been successful to date, with more effort to come to expand capacity. We have, as a city, so far delivered 500,000 third doses to people. And that is why I'm also able to confirm to you that 25% of eligible Toronto residents, 1 in 4, have already had their booster shot, which represents a very solid start. And in fact, something else to note within that number, the percentage of Toronto residents 75 years and older who have received their booster has in fact already passed 50%. And it's why you see us adding new appointments almost every day as we continue to ramp up, so even more people can join that number. This week alone, we've added more than 26,000 new appointments in our city-run clinics, including more than 6,000 new appointments over the Christmas holidays and more than 14,000 new appointments over the New Year's weekend. COVID-19 won't take the holidays off, doesn't take the holidays off, doesn't even know it's a holiday, and so we're not taking the holiday off either. Our team is going to be working through the holidays to make sure that we can vaccinate people, and that's why we've been able to open up those appointments, because people agreed to work during those particular times. And so I want people to know, again, this is part of the reason why we're here, to pay tribute to the Team Toronto members here at Woodbine, and we will be out again doing so on Christmas Day, because there are people who have stepped up and said they would work on that day. Now, I should also say one more thing that's very important as part of the first part of the vaccination action plan, and that is that we have another challenge on our hands due to the very same illness in many cases, and that is the challenge of having a contingency group on plan or at least on deck, so that if we have some of our providers that can't be at work giving injections because of their own illness, we have people to step up. And so I would just say that if there are any doctors or nurses or other people who have some experience in this area giving inoculations to people, that you might step forward and let us know that, because it would be helpful to us in our efforts to continue to increase capacity. This will help us with that. The second task in our action plan is to continue outreach to residents who need the most support. Throughout the pandemic, we have worked very hard as a city, and Councillor Cressy and the Board of Health team have showed a great deal of leadership on this, making sure that no one is left behind. It's been a fundamental value that has been underlying our campaign throughout the pandemic. That is why we did launch in 2020 the COVID-19 Equity Action Plan, and we've been working as, again, another part of Team Toronto with literally hundreds of community ambassadors and community health organizations and others to make sure that people get the support they need. And then later on, when vaccines arrived, we made sure that they were given all the encouragement and information they needed to feel comfortable getting vaccinated. Our vaccine engagement teams, with almost 400 ambassadors on the ground, have engaged almost 1 million residents across the city, focused principally in the hardest hit areas where they suffered a higher rate of infection with COVID, but also needed some more encouragement and support in order to be able to get tested and get vaccinated. Before Omicron, we announced that we were extending the vaccine engagement teams to July 2022 so that they could continue their important outreach work and help families, including kids, to get vaccinated. And that work will now be expanded to include helping those very same people and families to get their third booster dose. I'm proud to announce again today as well that we will be investing approximately $1.2 million to extend the work of TO Supports to July of 2022. TO Supports is an organization that has, or a program that has leveraged community expertise and partnerships to support Toronto residents who are most disenfranchised by the pandemic. So in other words, facing consequences from the pandemic that may not be faced by everybody. This includes 11 partner agencies across Toronto providing support dealing with things like the effects of the illness itself, food access issues, PPE that people might find they're unable to source on their own, wellness checks, housing, income support needs. These are all the kinds of things that the TO Supports program has been doing throughout the pandemic, and we've extended those supports to people who are in need through to July of 2022. This has also included, very significantly, 15 mental health partners across Toronto providing relevant and culturally responsive help to people with their mental health issues, because we know that the pandemic has taken its toll, and that has included people who are able to provide sensitive and customized support to seniors, to children and youth, to Indigenous residents of Toronto, and to some of the members of our Black communities here in the city. This also includes, as many people will know because it's been very well used, a triage service via 211, where you've been able to count on phoning that number, 211, and getting an in-person response to help you with a referral for mental health issues. And it's helped many, many people over the course of the pandemic. Because residents living in congregate settings may have limited access to vaccine clinics and face a huge potential for acute and severe outbreaks, Toronto Public Health has redirected its mobile teams from malls and community centers to support the high-risk populations in congregate areas and settings, which include some Toronto community housing buildings. The third aspect of our action plan for Omicron is elevated emergency response. We would want you to know that we fully reactivated the city's Emergency Operations Center last week, and this is the place where we can make sure that things happen at wartime speed, and that we make sure that the essential and critical services you rely on as residents of the City of Toronto continue to be provided. And of course, they provide assistance to all of our COVID teams in all different areas to make sure things happen well. The fourth element of this action plan is to ensure that we show ongoing cooperation and demonstrate ongoing cooperation with the other governments and increased advocacy for emergency supports for people and businesses. I want to thank the Government of Canada and the Government of Ontario for stepping forward with enhanced supports for businesses and individuals impacted by provincial public health restrictions. This is important support. It will help these businesses and residents get through this next wave that we're currently experiencing. I will continue to be in constant contact, as I have been throughout the pandemic, with both of these governments to make sure that we continue to work together to help people as best we can and to protect the progress that we were just really beginning to make in terms of economic recovery, which is so important, not just to businesses, but to the people who are employed by and who own those businesses. I repeat a request I've made many times in the last weeks and months, but it bears repeating. Please, in order to do your part to help people and businesses, and it's both people and businesses, because businesses, what are they? They're consisting of people who own them and who work there and who supply them and so on. So please, in the remaining time and over the holidays, when it gets to Boxing Day, shop local, dine local, take out local. Please support local businesses in the city of Toronto, smaller businesses especially. They're the ones that have been hit the hardest. They didn't have a lot of extra resources to rely on when the pandemic hit and when it's gone on so long, and they've gone through, as you know, going back to last Christmas, extensive periods where they've actually been entirely closed down. To conclude for today, I just want people to know that we, in a very broad collective sense, this very big team of thousands of people, led by some of the people that are here, but we very much know that we're only as good as the people who support us and are members of the team. We are working nonstop to respond to the threat of Omicron. We will get through this thanks to the work that has been done, really going back some time now over the last 2 years in terms of things that have been done in the neighborhoods and preparations that were made to have clinics, and even the decision we made, which was a fortunate one, to keep our city-run clinics open so that they were ready to step up and ramp up when we needed to start with the boosters. This is helping, but the help that's been of most assistance to us has been the help given by individual residents who have come forward to get tested, to be vaccinated, to follow the rules, to wear the masks, to wash the hands, to limit and to carefully consider how they socialize with other people. I know it's not easy, especially at this time of year. This is the time of year when we count on getting together. People come from far and wide to be together with each other. But if people can, carefully check on how they're socializing and reconsider things and make groups smaller and make it more confined to the people you generally spend time with in your own household to the maximum extent possible, this will help alongside the vaccination efforts that we're here to talk about today. So if we all get boosted, if we all continue to mask up, if we all are safe and careful this Christmas, and if we all stay home, especially if we have symptoms, this is maybe the most important thing of all, then we can get through this and get back to the kind of reopening and recovery that was underway with the Delta variant. I want to thank each and every member of Team Toronto, including all the employees across the city public service, because they're working, many of them through and right through the holidays, to help us face this threat right head on. The members of Team Toronto, hundreds and hundreds of them, they've gone way beyond just doing their jobs. I understand the fact that for people who do a lot of the different things, it's their job, but they've gone way beyond that in many, many cases, and they will be working Christmas Day, and they will be working New Year's Day, and the days in between when many other people don't necessarily have to. I believe that their dedication and hard work, and I've seen it firsthand with my own eyes, has been remarkable and continues to be remarkable. And as mayor, I will just say, and I know I speak on behalf of all of my colleagues on City Council and all the people of Toronto to say thank you for a job extraordinarily well done so far, with much more to come. And on that note, I'd like to ask someone else who's done an extraordinary job through this entire pandemic, and that is our Chief Medical Officer of Health, Dr. Davila, to present her remarks for today.
Thank you, Mayor Tory, and good afternoon. As this is my first update following my medical leave, I'd like to take a moment to sincerely thank Toronto residents, colleagues, and members of the media who sent supportive messages after I announced my leave of absence. I read every single one of your texts, tweets, and emails. Thank you. I'm grateful for your kindness and your support of me and the team at Toronto Public Health. I also want to take a moment to thank my colleagues at Toronto Public Health for their continued leadership during my absence. Today, we find ourselves in the upswing of another wave of COVID-19, dealing with the newest COVID-19 variant, Omicron, which is bringing us new challenges to face. While we're quickly learning about the nature of Omicron, there are some things that are becoming very clear in Ontario and here in Toronto. Dr. Kieran Moore, Ontario's Chief Medical Officer of Health, shared earlier this week that early evidence indicates that Omicron is up to 8 times more transmissible than the Delta variant. He also shared that as of last week, Omicron is the dominant virus strain in Ontario, and provincial hospitalizations have increased by 9% in the past week. In Toronto, our situation has progressed quickly. We're now seeing more than 1,000 COVID-19 cases each day, and even more we can expect in the next several days, and a steady increase in our percent positivity and in the reproductive number. This isn't where we want to be, especially during the holiday season and after the past 22 months that we've all endured. I know it's exhausting, and I know it can be frustrating. As we said last week, we may be done with this pandemic, but this virus isn't yet done with us. So what can you do? My message today is simple. It's about what we know works and what is within our control. We know that vaccines protect us by preventing virus spread and mutations in the first place. Vaccination and boosters provide the best protection we have, particularly against severe disease. This is why it's more important than ever to ensure that you're vaccinated to protect yourself and those around you, especially those who are elderly or may be more vulnerable to the effects of the virus. The best vaccine for your booster dose is the vaccine that's available, as Moderna and Pfizer COVID-19 vaccines both provide the best protection we have against this virus and its variants. Over the past week, our Team Toronto partners have been increasing the capacity of vaccine administration. We've increased our capacity, as you've just heard, to give vaccines from 400,000 doses per month to now more than 1.2 million doses per month. And we're continuing to look at innovative ways to increase our capacity and vaccine availability across the city. As the mayor just stated, yesterday, Team Toronto partners provided almost 46,000 booster doses. This is an incredible achievement, approaching the peak vaccination levels we achieved earlier this summer. I am truly, truly grateful for the leadership of my colleagues all across the health system. Hospital partners, Ontario health teams, primary care, community health organizations, and the more than 500 pharmacies who, along with Toronto Public Health Clinics, are working extremely hard to make sure these vaccines are as accessible as possible to you. Thanks to the Herculean efforts of all of these partners, we have achieved in mere days the vaccination levels that it took weeks to reach in the summer. As challenging as things have been with Omicron, we do have a number of tools to protect ourselves and each other. We know how the virus spreads, and we know that public health measures and measures for self-protection help reduce the spread of COVID-19. After so many months apart, with provincial gathering limits now of 10 people indoors and 25 outdoors, you are being asked to reduce the size of your gatherings over the holidays and to attend fewer gatherings to reduce your contacts. I appreciate that this is not what we would have wished for our holidays, but this is needed to prevent virus spread, to protect our families, our friends, and our communities. This holiday season, I am asking you once again to explore creative ways to connect while remaining safe. Please consider meeting with friends and family outdoors or virtually. If you are meeting indoors in a small group with other vaccinated individuals, consider opening a window to increase ventilation. Please also remember to wear a well-fitting mask, wash your hands, maintain 2 meters physical distance with individuals outside your household, and of course, Stay home when you're sick. Finally, I ask that you please take care of yourself. Get outside for fresh air and some exercise as you're able to do so. Our city and our residents are incredibly strong and resilient. Throughout the pandemic, Torontonians have continued to demonstrate their strength and their resilience. And I know we can get through this latest challenge together. Have a safe and happy holiday. Please take good care of yourselves and each other.